On this episode,
Oh, I know my baby.
the moving story of a little boy lost
Someone would have just dumped him,
and found,
and I want to give him a good life.
Remember, I fit him in my whole hand before.
and Audrey's brave bid to save him.
And hopefully give him a fighting chance.
Bowie is bitten off more than he can chew,
Look at the size of that chicken bone.
and the power of love for two kids who need it most.
He's such a big bird, but he's so friendly.
No.
You make my world a better place.
Come on, there's your girl.
I can't depend on you.
Almost there.
In Sydney, Audrey and vet nurse Bree are on their way to check up on one of their very special little patients.
Look at my little boy. Hey, baby. Hi. You look very bright. Hi, Tiki.
2 weeks ago, cat lover Zarima rescued a 4-week-old kitten after he was found by the side of a road with a shocking deformity.
We'll go check you out. Do you want to come into the van and I'll have a good look at him in there?
I don't know if Mum had left him behind or someone would have just, unfortunately, maybe just dumped him. Because he did have a really big swelling on the left side of his stomach, and the swelling was actually almost as big as him.
He has grown.
He's grown half.
Because I remember I fit him in my whole hand before.
Honestly, as soon as I took him to the hospital, they did tell me that there was no chance, and the kindest thing to do would be to let him go.
Okay.
And then I thought, no, I wanted to hear from Audrey. And of course, straight away, she was in there and she's like, no, we're going to do everything we can for him. We're going to give the surgery a go and see if he can pull through.
Without emergency surgery, the little kitten's chances were slim.
We're really, really worried because he's got this big swelling inside his thigh, and we're quite concerned that it's a hernia and some of his bladder has come through and his small intestine. So we have to have a look, see if we can pop it all back in, and hopefully give him a fighting chance.
Everything just looks massive in this baby.
I actually didn't think he was going to make it at all. Initially, we thought he maybe had a small tear in his abdominal muscles, and that's where all the organs were herniating through. Once we went inside, it was a completely different story. We actually found he had not much muscle on one side, and the muscle had completely torn away from the wall. So it was a pretty big surgery, but we got there in the end.
Now it's time to find out if the surgery has worked.
The good news is all his hernia repair, so that muscle repair that we did on his abdominal wall, that's all stayed because I can feel that's intact. And there's no, intestines or bladder coming through like before. But that fluid's coming from somewhere, we need to find out where.
The kitten appears to be recovering well from the surgery, but there's a new problem.
And we've been monitoring this for the last 2 weeks and noticed that there is a bit of fluid. Not sure where it's coming from, but I'm really worried it may be the first surgery not working out, or is there something else that's happening? We tested it the other day and it did come back very suspicious as urine. So there's a small tear in the bladder, and it would be small because it builds up over a couple of weeks. We've got to go in and repair it, yeah. It's always a little bit of a blow, when you've done this big surgery and they've been recovering so well and then you hit this hiccup. But I think, the main aim is trying to find out what's going on and fix it as soon as we can.
Auntie Audrey and Auntie Bree are going to look after you.
We're going to look after you, okay? Zarima is a really nice girl. She rescues all these kittens and spends her own money, repairing them and making them better. So I think maybe she's called him Little Boy because she doesn't want to get too attached, but she's completely in love with him.
I come across so many animals that need help, or especially cats. There's so many stray cats and they don't speak, they don't have a voice. So we need to do it for them, and I want to give him a good life.
Hey mate, how you going? My name's Gerardo.
On the Gold Coast, Gerardo has a little patient with a big problem.
Bowie is a 4-month-old cavoodle that's been brought down by his owner because Bowie was chewing on a chicken wing and decided to eat the whole thing in one go.
He had it and the kids were chasing him and he swallowed it.
Oh, okay. Sometimes when they're big like that, they can go past the throat, but they're not quite make it to the stomach.
Yeah.
So we'll check Bowie out, make sure he's comfy, and then we'll come back through and have a chat as to sort of the plan and stuff. Is that okay?
Yep.
Owner Nick bought the puppy for his 2 young children.
Gave Bowie like a little chicken wing and he was outside eating it, and then he ran inside and started eating it inside, so we were like trying to get him and the kids were chasing him around. And usually I can trade him with something, so if he's got a pair of your undies I can get like a fluffy toy and do a trade. But yeah, he didn't give me that opportunity with the chicken wing. It was obviously very precious to him.
You thought that they were going to come and take it off you, so you're like, no, it's my chicken wing. Listen to, and you look at him out, no, little razor teeth. No, okay, it's definitely not the back of his mouth. So my concern is that if it hasn't made it all the way down to the stomach, it's stuck in his esophagus, and that can cause some pretty significant trauma. The chicken wing is about this big, and Bowie is about this big. So there's a possibility there that it may not have made it all the way down into his stomach. Your daddy did the right thing bringing you down so quick.
If the chicken wing is stuck in Bowie's esophagus, Gerardo fears it could puncture his food pipe, and that could be fatal.
Good boy, Bowie.
Nick has been waiting anxiously to find out if the much-loved family pet is going to be okay.
Big concern is that if it hasn't gone all the way down, it means it's stuck in his esophagus in his chest.
Yep.
And because of the size of it, if it stretches out the esophagus, it can cause pressure, and the pressure can actually cause a hole in the esophagus, and then it's deadly.
Nick and his family recently suffered the loss of a family pet, so to lose Bowie would be devastating.
We had another little dog and she recently died, so my daughter loves animals, so we sort of had to get another dog.
And how's Bowie with the kids?
Oh, really good, yeah. Oh, he's a bit bitey in the puppy stage at the moment, so he's mischievous. He steals everything, runs away with it, which is what he was doing with his chicken wing.
Okay, so what we need to do is take an x-ray, see where it is.
Yep.
The best outcome here is it's in the stomach.
Okay.
Because it's a raw bone.
Okay, it'll break down.
It will break down. It may take a while, but it should break down.
Okay.
If the chicken wing is lodged inside Bowie's esophagus, it could actually rupture the esophagus. And that is bad, bad news. Good boy.
Be a brave boy. Last one was very brave. You're dying to come out, don't you?
In Sydney, Audrey is about to investigate a worrying leak from rescue kitten little Boy's abdomen.
Oh no. You don't want to come out. I was feeling nervous and a little bit emotional before because, you know, just seeing how much Mum loves him and, you know, how much he's been through and him being so little. But now I think I'm on that role of let's find out what's going on, let's get him better.
The 4-week-old kitten has already undergone major surgery to repair a nasty hernia.
So we're just going to do some plain x-rays first. I just want to see how everything's sitting in the abdomen since the last big surgery.
Audrey's concerned there's still something seriously wrong with the tiny kitten.
X-rays. There's too much fluid in there.
So much fluid.
To have urine floating around in the abdomen means that there's a tear somewhere or there's some sort of leakage coming from his urinary tract, whether it's his bladder or the tubes coming in and out of the bladder, we just don't know. So because he's so tiny, he's so young, his body condition, you know, he's very small, the anaesthetic is always risky. So we just got to watch him closely, try and make it as safe as we can. So I've popped an anaesthetic tube in, and that just makes sure that we can keep his depth under control. And then once I'm happy with how he's going, I'm actually going to catheterize his penis into his bladder and start injecting some dye to have a look. It's like threading a needle but harder because they've got this little bend, so you've got to maneuver it really gently, and then obviously everything's minuscule size. So what I want to see is that dye filling up the bladder wall and just see if it's leaking out from anywhere. I hope that there's an obvious tear in the bladder and we can go in and repair it.
That's flowing, it's flowing, it's flowing.
X-rays. And as we take more and more x-rays, I'm feeling even more concerned because I'm not seeing what I want to see. I actually want to see a tear in the bladder because I know I can go in and I know I can fix that today. But it's filling nicely, there aren't any leakages, so now I'm even more confused. I'm going to say let's inject another 0.2. I'm going to inject half first.
Yep. Oh no.
So I look up in the monitor and I can see his heart's dropping, and it's dropping really low, and I go into panic mode. We need to stop everything we're doing and try and get that heart rate back up again.
Oh, now you're awake. It's right, just a bit of a stretch.
On the Gold Coast, Gerardo is about to x-ray 4-month-old cavoodle Bowie to try to locate a dangerously sharp chicken bone.
You're just so cute. We're gonna go take that x-ray now, hey? And make sure that chicken bone's in your stomach. What we need to do is find out where the chicken wing is, whether or not it's gone all the way down in the stomach or is stuck in his esophagus. Let's have a look, hey? Fingers crossed it's in your stomach.
Gerardo is worried that if the bone hasn't moved into Bowie's stomach, it could tear his esophagus, which would be fatal.
Put on your side. Oh, what a brave boy.
Okay, step out.
Oh, I thought I was gonna get it.
Did I get it? Did I get it?
Little Bowie is restless, and it may have affected the x-ray.
That's a beautifully terrible x-ray.
Gerardo now needs to attempt a second x-ray with the frisky pup.
It's okay. Good. It's good to stay still for like 3 seconds. 1, 2, 3, and that would have been enough. Here we go. TV, Bowie. Bowie. Gentle. We've definitely got that. Here we go. Success. I've taken an x-ray of Bowie's stomach and chest. Thankfully, the chicken bones are in his stomach. Look at the size of that chicken bone. That's huge.
Oh no, what, he cried when he swallowed it?
Yeah. High five.
Gerardo is now hoping the chicken wing will dissolve in Bowie's stomach.
Yeah, it's really good news.
However, the little puppy isn't out of danger yet.
There's a possibility there that the bones may get stuck in his intestine or cause a perforation. That is concerning. Hopefully, it should pass through.
So excited. I can't wait.
Danny's on the road today meeting with a friend who has a special relationship with animals.
Down, please. Charlotte, you're a good pig.
Lauren trains animals to perform in movies and TV shows.
You'll do the big one.
Hey, Lauren, how are you?
Hi, Danny, I'm good. How are you?
Yeah, good, thanks.
That's
this is our
good.
little patient today. You are so cute, darling.
Lauren's called Danny today because one of her on-screen stars, Larry, has developed a problem with his eye.
So aside from the eyes, is there any other concerns?
I was just looking at his nails thinking that they need to be done.
Oh, do they?
Yeah.
Oh, I think we can get that sorted. Well, let's go have a little look at your mate.
Great.
Hey? So if you look on the conjunctiva under there, it's a little bit inflamed. So there's no squinting or anything going on. I think for now, we could just try some antihistamine eye drops.
Danny's done a full eye checkup on Larry. He will get started on eye drops and has to be given the all clear to return to work.
All right, let's clip those nails, sweetie pie. Sorry, yes, we've got to. Has Larry been in any films lately?
Yeah, he just finished on a big one last week. He was on it for a few weeks,
Little
actually.
superstar.
Yeah.
All right.
As well as starring in movies, Lauren's menagerie of animal actors also play another important new role.
Oh, there we go. Good job.
Lauren recently started an animal therapy program for special needs children.
We've actually got a few sessions today if you want to hang around and watch.
I'd love to. Oh my goodness, that'd
Fantastic.
be wonderful.
Yes.
Oh, gorgeous. I've heard so much about them, so I'm really excited. All right, I think your nails are all done there, mate. Yay! Yay! Mwah. All done. All done. You were very good.
I'm going to inject half first.
Yep. Oh no.
In Sydney, Audrey's patient little boy is suddenly in trouble.
No, I'm just giving him atropine to try and get his heart rate up again.
Oh, baby.
Going up. It's going up. The heart rate's going up slowly.
Just keep the oxygen on though.
Bit of a scare. Baby anesthetic, it's always scary. Whenever you're doing an anaesthetic and you're concentrating on what you have to do and then there's an anaesthetic complication, there's a lot of pressure because you're trying to do the procedure, you're trying to get the anaesthetic stable, and at the back of my mind, I'm just seeing Zarema, you know, really holding on to little boy, and he means everything to her. So there's so much pressure in an emergency situation.
Little boy is finally stable, but the x-rays haven't revealed the cause of the worrying leak in his abdomen. So Audrey now wants him to get specialist treatment.
Hello.
Look who's here. Hello.
He's purring already.
It's time to tell anxious owner Zarema that her precious kitten's future is still uncertain.
The bladder does fill up with contrast, or the stain that we put in, and I can see the nice balloon of the bladder, and I can actually see, you know, the tube where it comes out through his penis. I can see all of that looks great. There's no leakages there. So then the question's coming, where is it coming from?
I honestly don't know what to think. We were hoping it would be perhaps a tear in the bladder or something that we could repair, but at the moment, there's a big question mark. We don't know. That's kind of what I was afraid of.
I love you.
Oh, chicken, what are we gonna do with you?
Can you smell it? Can you smell it? Come on, chicken. You're gonna make sure you can eat some food properly.
On the Gold Coast, Gerardo is trying to coax cavoodle pup Bowie to eat some chicken, but this time, no bones.
Don't like the chicken. First dog on earth who doesn't like the chicken.
After the earlier scare with a chicken wing, Bowie seems reluctant to try the cooked meat.
Bowie was eating a chicken wing and swallowed it whole and yelped in the process. And he's not a very big boy. Okay, ready? Hey, look at this. Nom nom nom. I'm gonna eat it. Look at it. I'm gonna eat it. Nom nom. Nom nom. Nom 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 nom. I ate it. It's safe.
Gerardo tries an unusual tactic.
Oh, come on. Good boy, good boy. Nom nom nom. Good boy.
And it works. Before Bowie can head home, Gerardo needs to have an important chat with owner Nick.
So this is an X-ray of the side view of Bowie. This is his chest. And then this is his stomach.
Yeah.
And then this is the chicken bones.
Yeah.
You can see they're like huge.
Yeah.
Yeah.
Stomach, massive.
That's gonna sit in there for a while.
Okay.
But it should slowly break down. One concern is that it could obstruct a piece of intestine.
Yep.
And then he may require surgery, or if it actually perforates, if it sticks through the actual stomach wall or something, then that's an issue as well. But, you know, it's a fair chance that it'll pass through, and I think it's worth giving it a go.
Okay.
If you can monitor them closely.
Yep.
I explained to Nick that now that the bones are inside Bowie's stomach, the likelihood is that those bones will get broken down by the stomach acids. Here you go, mate.
I'll wait.
Oh, I'm so glad I was able to give Nick this news, because they've only had Bowie for a couple months and they love him dearly.
Awesome. Thanks a lot for your help.
That's all right, no problem. You take care, Bowie.
There you go. Yeah.
It's turned out to be an extra special day for Danny.
Oh, darlings. They say never work with animals or children. They couldn't be more wrong.
Yay! Good job, Chandler.
Danny called to check on the health of one of her friend Lauren's animal actors, and she's been invited to stay on and join in on an animal therapy session for special needs children.
How do you find the animals make you feel when you're around them? Yeah?
And my heart is full of love for them.
Oh, that's a lovely thing to say. Something about animals, I think. Yeah.
Are you ready for Romulus?
Yeah. Hello.
Oh, it's your friend.
Oh, that's the sweetest thing in the world.
Liam's been coming here every week. Not a lot of people would find this a calming activity, but Liam does.
What is it that you love about Romulus so much, Liam?
He's such a big bird, but he's so friendly.
I think he trusts you too.
Oh.
Oh, no. Nope. Nope. I think he's got his favourite.
Oh, good job, Liam.
Watching Romulus and Liam together, the bond they seem to have and this connection and understanding of each other and the calm that came upon them both, it's truly miraculous. I think you're number one, Liam.
The animals, to me, have always created magic, so to then be able to see it go on to these children, there are no words. Oh, well done, Tanner.
Nice.
Woo! Well done. Good job, Danny.
Tanner, you're way too quick. This is a lot harder than you make it look. I'm so embarrassed. Oh my goodness. Do you have a favourite animal?
Probably dogs and reptiles because I love them since childhood, so they've always kind of been there and I've always loved them. Yeah, very therapeutic.
I want to come hang out here every week too.
Who wouldn't?
I know, exactly. Good job, you guys. Well done, both of you. Most of my life is devoted to the care of animals and looking after their health and well-being. It really is nice to be reminded that animals truly do have the power to heal us. Thank you so much for such a rewarding day. It was just beautiful.
Oh, thank you for coming. The kids loved having you.
Pleasure. Oh, I've got to get going, little Larry. Let me know how you go with his eyes, okay?
I will, absolutely.
All
Thank
right,
you.
See you later, guys. Bye.
Say bye.
Hi, Zarima.
Oh, hello.
Hi, I'm Andrew.
Nice to meet you.
Lovely to meet you.
Hello.
This is little boy.
It is.
Hello, little boy. Hey, kitty cat. What's hello? Ow. You got me already.
Zarima and little boy have now arrived at the Small Animal Specialist Hospital for a consult with surgeon Andrew Marchevsky.
He's quite bright, and in a way, if a cat's got all this urine in his tummy, he really should be much sicker. I guess the possibility is because it's been there for literally half his life, maybe he's just thinking, well, that's my life. Oh, hello.
Oh.
Yeah, and that's my life, and okay, and they get on, so you might have adapted to it. You know, an ultrasound is a really easy way to have a look inside. Don't need to anaesthetise him, don't need to sedate him, and if we see some fluid, we can get a sample.
I'm definitely happy that he's in your care
Great.
and he's in everyone's care.
Yeah.
And I think he can feel that too because he won't stop purring and playing, and I think he likes all of you because he knows that you're going to help him.
I don't think you'll get it anywhere near the nurses because I'm going to carry you around because I can put you in my pocket.
Yeah, that's true.
Yeah.
Thank you.
Talk to you soon.
Thanks, Andrew.
Cheers.
Bye-bye.
Bye-bye. Come on, little boy. Where are you going? We'll get you sorted. I guess what we're trying to find out with little boy is, has he still got fluid in his tummy? And if he has, what that fluid is. Because if it's urine, he's in a heap of trouble.
You can't imagine anyone living life having fluid constantly building up in their abdomen all over. So I am scared.
There's some urine in it.
A little bit of urine, yeah. Oh, little boy. You're a real wiggle puss. Do you think that's an amount you'd be able to sample?
But as little boy's ultrasound gets underway, the results are not what anyone was expecting.
You're okay. I'm looking at this ultrasound and the first thing that strikes me is there's not a huge amount of fluid in there. I don't think there's much going on, and the bits that I can see of his kidneys, they look okay, so it's really kind of exciting. I think really from my point of view, it's just there's no fluid there, which considering what it was a few days ago is great. So given what we're seeing on the ultrasound, he might actually be okay, and I don't think he's going to need surgery.
Hello.
Where are you going? Come on inside and we'll have a chat.
Hi.
So first and foremost, the ultrasound showed there is no fluid in there.
Any more?
None. It's gone. It's gone.
It's gone?
It's gone. Gone.
Really?
Yeah,
All of
no.
it's gone?
Yeah, it's all gone. He'd had a major trauma and it had been there a while and was just all irritated and the fluid was building up. And now with the tincture of time and TLC, it's gone.
I cannot believe it because so many times I've been told, it's time to say goodbye.
Oh.
Everything's gonna be okay, okay? The moment I got him, I knew, I was like, I could never let you go. That's why you have to make it through. And he showed us that he wants to.
good people have looked after you. Yes?
He's so full of life.
Bunny, come this way. Bunny, here.
Back at the emergency hospital, Gerardo's next patient is blue heeler Bondi. The 1-year-old has been rushed in, suspected of eating deadly rat bait.
You gotta let me come a bit closer, hey? I know. He's a little bit nervous. Come on, mate. Bundy was brought down by his owner because she found him chewing on a block of rat bait. It's okay, come on. Rat bait is highly toxic and deadly to dogs. If a toxic dose is ingested, the blood stops clotting, which can lead to bleeding and potentially death. It's okay. It's okay.
The rat bait was stored in a backyard shed, and by the time owner Jess found Bundy, he'd shredded the packet.
I actually googled a little bit to see how severe rat bait could be to a dog, because I didn't really know. I went up to my neighbour and I was like, oh my god, what do I do? And she's like, take him to the vet. Bunny absolutely means the world to me. I'd be really lost without him. I would not even consider on getting another dog after him. He's just my life.
Nice and slow. Lung sounds are okay, heart sounds fine. Just go on the other side.
Although Bundy isn't showing any obvious signs of ill health, the deadly toxin from the rat bait could be already spreading throughout his body.
Have a look at your gums, mate. Nice and pink. Ooh, good boy. No evidence of bleeding or anything like that there. Check the other side, nice and pink. What we can do now is rub a tablet on Bundy's gum, and that tablet will make him feel sick. We need to make Bundy vomit to try to get rid of as much rat bait as possible. Good boy. Hey, that wasn't that bad, was it? That wasn't that bad. That wasn't that bad. Fingers crossed, he brings up all the rat bait. It's okay. Good boy.
It's a busy day for Audrey and Alison.
We're here.
They're heading out of town to one of their favourite animal shelters, the Possumwood Wildlife Sanctuary.
All right, let's get ready. See how he stands on it really well now?
After a quick checkup on baby wallaby Buzz,
Yeah, he actually hops on it very well. Oh my goodness. Buzzy, can you sense we've got some new visitors?
they're about to de-sex a group of rescued dingoes waiting with their protective carer, Charlie.
Hi, Charlie, how are you?
Good, thanks.
Oh, your little friends. Who do we have here?
This is Matisse,
Hi,
one of our little rescue dingo puppies.
He's one of the three boys.
One of the three brothers.
De-sexing today.
That's it. And Ada, yes.
Charlie is the founder of the Sydney Fox and Dingo Rescue.
Hey, sweet boy.
So they are wild dogs, so how did they end up in care with you?
So these guys were found in a mining site. So the mining company had accidentally unearthed a den and the parents had left and were nowhere in the area, and the pups were very, very young. Luckily, one of the workers actually took them home with her and got in touch with us and bottle fed them and looked after them. They are considered a pest in a lot of areas and they're hunted pretty ruthlessly. We get a lot of orphans because of baiting, and also up in Queensland they're still allowed to use things like strychnine and arsenic, which is horrendous.
Once rescued, dingoes are not legally allowed to return to the wild, despite being native to Australia.
Obviously all our dingoes are desexed, which is why we've got our dingoes here today being neutered, because they can't go back to the wild, and there are far too many dingoes in captivity and far too few homes for those dingoes to go to.
Who's going to go first?
Maybe Ada.
Yeah, if we start with Ada,
Yeah.
and then we do the boys.
Our girl.
Our gorgeous old girl.
Very calm, actually.
Yeah. She's an absolute sweetheart, aren't you, Ada?
Unlike the male pups, Ada is a victim of the dingo pet trade.
So Ada was actually dumped. She was left on a lady's porch, tied up, no microchip, not desexed, in pretty poor body condition.
She's lost her incisors at the top. Was she locked in a cage or something where she was chewing down?
It's quite possible.
Chewing on chains, they just completely grind it down.
We get asked to take multiple ex-pet dingoes every week that can no longer kind of be taken care of by their former owners. People who've seen a cute fluffy puppy and thought that they would be like having a normal domestic dog, and obviously they're quite different and quite unique. I mean, they are essentially wildlife.
I'm just pressing there on her trachea and it's causing a lot of reaction. That would make me worried it might be something like kennel cough.
Ah, okay, yeah, sure.
Which is easy enough to pick up. You do have to be careful with being around
With
the
the other little ones, yes.
So we are concerned about the cough today because it could be contagious and infectious, so it could potentially spread to the other dingoes, any unvaccinated puppies.
We might delay her surgery.
Yep.
Only because the anaesthetic, because the anaesthetic is a bit stressful on their respiratory airways.
Yeah, for sure.
So we'll pop her on some antibiotics for 2 weeks.
Yep.
And then I probably will check in with you.
Yeah, cool.
And then schedule her for her desexing next time. Yeah.
Awesome.
Here we go.
On the Gold Coast, Gerardo is urgently trying to save blue heeler Bondi
Hey Bundy, this is your tray, mate.
after the young dog was found with an empty packet of deadly rat bait. Bundy's been given a tablet to induce vomiting that will hopefully prevent any deadly toxin from quickly spreading through his body.
He'll start to slow down soon, hey? The way we know whether or not dogs have eaten rat bait is that when it comes up, it's bright green.
Good boy. Okay. Okay. Good boy.
Within minutes, Bundy reacts.
Good boy. Good boy.
Bundy, you ate the green stuff. Oh, you're not supposed to eat that stuff. I can see immediately that he has had a huge dose, more than enough to cause toxicity. We don't know how much has already gone through his stomach, so we might start him on the antidote as well, because there's probably enough absorbed already that could cause toxicity.
Owner Jess is anxiously waiting to find out if her best mate is going to be okay.
I don't know what life would be like without him. It'd honestly be lonely. Watch TV and he's always up on your lap. So yeah, I'd be really lost without him.
Okay, that's right. It's good that it all came up, hey?
Before Bundy can be reunited with Jess, Gerardo is giving him an injection to help relieve the nausea.
It's a bit scary. It's all a bit soft. But you're good to go home now. You've got some tablets to go home with. What I'm going to do is send Bundy home with the antidote, which is vitamin K. That should protect him against any toxin that he may have absorbed already. Who's in there? Hey, hey, hey. I love it how you're scratching his back, because I just found out that that's where he likes getting scratched.
Yeah, loves it.
So he's had an injection of the anti-nausea medication, so he's fine to go home. And he can have some food when he goes home too, and have that tablet.
Yeah.
She's going to continue giving Bundy the vitamin K for the next 4 weeks. If Jess didn't bring him down, it's very likely that he would develop a severe bleeding disorder in about 3 to 4 days. So this is a great outcome for Bundy. Okay.
Thank you so much for your help.
That's right.
I'm just pressing there on her trachea and it's causing a lot of reaction. That would make me worried it might be something like kennel cough. You do have to be careful with being around
With
the
the other little ones, yes.
At the Possumwood Wildlife Sanctuary, Audrey and Alison are about to desex 3 male dingoes.
All right, first one up the rank, Matisse.
Matisse, you've been moved up the rank because Ada's not going ahead. All right, let's get your weight. 13 kilos.
Well, it's our first time ever treating or doing surgery on just dingoes, pure dingoes, and I think they're pretty cute.
They're
very active.
They're really active, they jump around a lot, but really lovable.
All right, little needle. Sleepy time.
Oh, he's a bit cute, isn't he?
I like him when he's sleepy.
Can we just cuddle him all day?
We would have thought that we'd actually be sitting here with a dingo today in our wildlife hospital.
The journeys we have gone.
Pre-med's working.
So desexing Matisse is going to be like desexing any other male dog that we do in the clinic. It's just one skin incision where we get both testicles out, so we actually leave the scrotum in place.
Okay, all done. Let's stitch him up. He's all done, so ready for the next one.
While Audrey and Alison move into desexing their next patient,
nothing going on, just vibration.
rescuer Charlie helps watch over the recovering dingo.
All right, little one.
Hey, lucky lost.
So we're all done.
We've done Banksy, Rembrandt, Matisse, and Ada. High five.
So we come out into the waiting room just to check on all the dogs that we've desexed today. And there's one more patient left, the lovable Ernie.
So Ernie was poisoned by 1080 bait up in Queensland, so he actually started having seizures. He aspirated and got pneumonia in one lung.
Oh gosh, okay.
And
That was during the seizure?
During the seizure. He's just had a rough ride, haven't you, Ernie?
Ernie was left with serious complications from the poisoning. He was rushed to Specialist Animal Hospital Sash for life-saving treatment.
Because he was feeling so unwell, he wasn't eating, which is why he's lost quite a bit of weight and had to have the feeding tube placed.
How old is he?
So he's about 5 months old, we think, but
Younger than these guys.
yeah. So you can see the difference it's made to his poor little body. So he's got a long way to go.
All right, let's get him into surgery. I might need a hand with him because he's a little bit scared.
Yeah, for sure.
Ernie's pretty sad. I mean, he looks really sore. He looks quite, upset. So we're just checking in on him today, checking his gastric tube, make sure that he's recovering well.
Yeah, he feels a bit warm. I don't know. I think I'm just so paranoid about everything now that I'm like, we just check his temperature.
Anything indwelling is always a higher chance of infection, so you want to make sure that we keep infection away.
That's looking a little bit better, little man.
Yes, I know. All right, baby.
Okay.
That was it. We're not going to touch you anymore. You've been through too much, okay?
Done. You're done.
Done. Send you and your friends home. Here we go.
They are amazing animals, but they're not a typical pet, and they do belong in the wild. They are part of our wildlife. I would love for it to be possible for wildlife carers to release dingoes back into the wild. I would like to see better protections for them and a more compassionate way of coexisting with these fairly essential animals that really deserve that kind of recognition as the native animals that they are.
Any opportunity to come and visit an animal shelter, just give some advice or help out is a good day. So today is a really good day. Here we are.
In Melbourne, Danny's calling into an animal shelter that has special meaning for her.
Save a Dog holds a very special place in my heart because it's where my husband and I adopted our first dog, Willow, and she was such a special soul. She was quite traumatised when we first got her, and seeing her come out of her shell and become a happy dog again was the most fulfilling thing in the world.
Danny's meeting up with shelter owner Pam.
Hi Pam, how are you?
Danny, how are you today?
Good to see you.
Thanks for coming.
Oh, pleasure. How have you been? Been busy since I was here last?
Yes, very as usual.
Oh, I bet. So Pam, how long has it been now since you opened Save a Dog Scheme?
Oh, nearly 36 years.
Isn't that incredible? You are just a Wonder Woman, my goodness.
No, we had a lot of help. There's been a lot of wonderful people who've helped me.
Absolutely. Oh, hello.
Hello, Moses.
This is Moses. Hello, aren't you gorgeous?
Yes, he is. He's lovely.
Oh, thank you.
But today, it's not a social visit. Danny's here to check up on rescue dog Gumnut.
Hello, darling Gumnut. Hi.
Very trusting little soul once she gets to know you.
Shelter General Manager Margie has been caring for Gumnut after the little rescue dog had to have most of her teeth removed.
We'll have a good look at that mouth and make sure everything's all healed up nicely today.
Excellent, thank you.
Let's have a little looky here. It's got the front teeth there. We've got a couple little premolars down the bottom there. Well, other than those teeth, I think you look like you're in pretty good shape, darling, considering your age too. Now we just need to find a loving home for you, little darling. Okay. In the 36 years you've been doing this, how many animals have you saved?
Well, many, many thousands, maybe about 40.
40,000. Feeding time over the years must have been an enormous challenge with all of those animals.
Yes, it is quite chaotic at times.
I bet.
We now have this amazing device,
Oh.
which has made it a lot easier.
Oh, really? Fantastic.
Yes. Would you like to have a look at it?
I would.
So, Danny, this is what we've been using.
Oh, I know this device. This is fantastic for portion control. And then every dog gets exactly what they need.
You know about it. Would you like to do the honours?
Oh, well, why not? Good boy, mate. Oh, Moses, you're so beautiful. Oh, I'd love to take him home.
We can provide about another 40.
Oh, well, let's take him all home.
Yes, I'll bring the car around.
Okay.
Oh gosh, such good news. I can't wait to see you.
3 days later, Audrey is checking up on her miracle patient.
Do you know all the heartbreak you've been causing everybody? Huh?
So little boy looks completely happy and normal today. He's running around. You wouldn't even know all the trauma that he's been through.
And your hair's growing back.
Look at that. Gosh, his belly is back to normal. I think little boy is the luckiest cat that ever lived. He's got Zarima, who loves him to death, would do anything to help him, you know, get through this. And I think it's because of all her love and tender loving care that he's actually pulled through. And I think he's come to the right place.
Yay! I just think all the tears and all the pain and the sleepless nights, I'm like, did that actually happen? Because he's presenting like completely fine now. It's unbelievable.
And the chicken wing that Bowie gobbled down fully dissolved with no ill effects. Chicken bones are now off the menu for the mischievous little pup.